key imperative is to get our healthcare protocols readjusted, in fact, reconfigured. And they need to shift decisively to cope with a much larger number of infections. Based on the characteristics of Delta variant, which DMS has presented, we will make the following 4 major changes. First is quarantine. At these numbers, our contact tracers can no longer interview every infected individual. Instead, we will focus our resources to deal with vulnerable settings and large clusters, such as hospitals, schools, nursing homes, should they be infected. We will also rely on simpler, scalable methods, such as automatically quarantining household members of the infected and then make them serve home quarantine. We will also generate a list of close contacts using trace together data. So for very close contacts, we will send out health risk warnings so that they will get themselves, they are required by law to get themselves tested and self-isolated until they receive a negative result. For contacts that are not as close, we may send health risk alerts for them to just monitor their own health closely. Second change, as the incubation period for Delta is shorter, as explained by DMS, with a median of under 4 days, we will shorten the quarantine period from 14 days now to 10 days. This will be less disruptive to people and yet capture a significant majority of infected cases. Third, based on the finding that infected individuals with CT above 25 are no longer infectious during the recovery phase, we can also bring forward discharge. We will now allow discharge for day 7 if he is tested negative for CT above 25. If not, he will be discharged at day 10. We will continue to review the data and tweak the discharge policy accordingly.